Today, our topic would be a combined topic for biochemistry, medicine, pediatrics. And this topic would cover some of the basic points about some important minerals in our body which are present in low concentrations. First of all, starting with one of the important constituents in our body is selenium. The selenium is an important component of one of the important enzymes in our body, which is called as the glutathione peroxidase. This glutathione peroxidase has got a very important function in the body, that it has got an antioxidant role. As lately there is so much of research going on antioxidants like vitamin A, vitamin C and selenium. So the selenium happens to be a focus of medical researchers nowadays. So as far as the selenium is concerned, this glutathione peroxidase gives it the added importance. And in case we have got a decreased concentration of selenium in our body, a question frequently asked is that it can manifest in the form of a cardiomyopathy and what we call as Keeshan's disease. Now, if we go back to the origin of this Keeshan's disease, the Keeshan's disease takes its name from a Chinese province wherein we have got more people getting this type of disease. So Keeshan's disease is a form of cardiomyopathy, and these decreased selenium levels in our body can be associated with increased risk of cardiomyopathy. Now, once the antioxidant role is gone, these patients are highly susceptible to multiple types of cancers, in addition to coronary artery diseases. So deficiency of selenium in our body can cause increased susceptibility to cancers, can cause increased rate of coronary artery diseases, and number third, cardiomyopathy. So we are done with selenium, and what is the next important mineral about which multiple questions are asked? I would take magnesium. So magnesium is another micro element in our body, and basically what causes decreased levels of magnesium in our body are the causes of hypomagnesemia. And what are they? We can have prolonged vomiting, prolonged diarrheas, excessive use of diuretics. You have to be very careful about those dehydrating conditions: excessive vomiting, excessive diarrhea, and I mean to say uncontrolled use of diuretics. And one more important factor, chronic alcoholism. People who take alcohol chronically can have depleted or decreased magnesium levels in their serum. And what is important about this hypomagnesemia is that the features resemble somewhat to calcium deficiency in our body. And how can the patients present with? Basically, patients can present with muscular weakness, and characteristically on ECG we can have prolonged PR interval. Not only prolonged PR interval, increased QT interval as well. And you know that can lead to arrhythmias, arrhythmogenic potential as a result of hypomagnesemia. In addition to all these features, we can elicit those signs which are typical of hypocalcemia, like the Troisier sign and the Chauvetsk sign, and a patient can land into carpopedal spasm. So we had to have these selenium and magnesium levels well controlled within the body. Do we have any other element about which multiple questions are expected? Yes, surely, copper. I have given a brief description of copper in my previous lectures, but today I will just take something in addition, because this copper biochemically is important. Important in what? An important constituent of certain enzymes. And what are these enzymes? These enzymes are more important 4 enzymes. Amine oxidases, number 1. Number 2 would be the cytochrome C oxidase. Number 3 would be superoxide dismutase, and we cannot ignore the role of superoxide dismutase in our body. Then the 4th would be dopamine hydroxylase, and sometimes questions simply are asked. The constituent, the main constituent of this enzyme is A, B, C, D. Say copper, iron, magnesium, selenium. So questions can be asked in multiple manners, and that is why the concept is needed. So this question can be asked in biochemistry, this question can be asked in pediatrics, this question can be asked in general medicine, this question can be asked from neonatology viewpoint as well. So we have got this copper, and we are already aware that in case there is deficiency of this copper, we can have features like stunted growth, like vomiting, like diarrhea, like osteopenia, microcystic hypochromic anemia. We can have classic Menkes disease, features of stunted growth associated with umbilical and inguinal hernias. We can have those hair changes in Menkes disease, like dull, sparse, hypopigmented, depigmented hair. So we have to remember that copper deficiency can cause a huge range of symptomatology. Or in addition to that as well, we can have excess copper deposition in our body, that class which I have discussed, the Wilson's disease or the hepatolenticular degeneration, an autosomal recessive disease in which there is excessive deposition of copper in the liver, the brain, and the eyes, leading to features like hepatomegaly, cirrhosis, portal hypertension, jaundice. As far as the liver is concerned, in the eyes, deposition of copper in the Descemet's membrane, and leading to classical Kayser-Fleischer rings or KF rings, which can be examined by slit depth microscopy, or the features, neurological features, because of deposition of copper in the lenticular nucleus, which is a part of basal ganglia concerned with movement, and we can have tremor, chorea, spasticity, and in addition to that, multiple psychiatric disturbances like aggression, depression, psychosis, neurosis. So this copper as an element, both if we have decreased copper levels or we have increased copper levels, both are detrimental. Then in addition to that, my vision goes towards chromium as well. Chromium is a micronutrient present in our body, and this chromium is asked frequently. Why? Because it happens to have an impact on glucose metabolism. What it causes, it improves glucose tolerance, and in case of decreased chromium levels, we can have impaired glucose tolerance in our body, which can lead to subsequent diabetes mellitus. In addition, it has been seen that long-standing cases of chromium or decreased levels of chromium over a long period of time can cause associated features like neuropathy, as well as psychiatric disturbances like confusion. So impaired glucose intolerance or impaired glucose tolerance, to be more specific and to be more correct, neuropathy and confusion, they are a result of chromium deficiency. So we have to remember that fallouts of selenium deficiency, magnesium deficiency, copper deficiency or copper excess, and chromium deficiency. I hope you are a bit enlightened and helped by these certain facts. Thanks a lot.